It's back. Yes, COVID is on the rise again. The United States is reporting more than 94,000 new COVID-19 cases each day. That's up 47% since late October. And sadly, 1,100 people a day are dying from COVID. 35 states, nearly all of them in the north or mountain region, have seen an uptick in daily cases of 10% or more in the last 2 weeks. And experts are also warning that a new COVID variant, Omicron, may be making its way to the United States very, very soon. This is leading experts to ask, how effective will current vaccines protect against this new variant, and why are cases going up yet again? Experts weigh in, all coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
The new Omicron variant has many doctors on edge and has the president speaking out at a press conference just Monday, trying to help the country, as he says, take pause and not to panic. But many are asking, is this variant more transmissible? Is it better able to evade the body's immune responses, both to vaccination and to natural infection? And what should we all be doing to protect ourselves? Here to help us understand what this new variant means and what's going on with COVID-19 are two of our favorite doctors. They've been with us throughout this entire journey of trying to understand COVID-19, its impact, and how we protect ourselves. Joining me first is Dr. John Moore. He's an immunologist at the Weill School of Medicine at Cornell School of Medicine, and he's our resident, I feel like, vaccine expert. Thank you so much, Dr. Moore, for helping us once again. Just when we think we're getting things under control, the headlines are back telling us that things might get worse before they get better again. So I want to start with this new variant, Dr. Moore. What's going on?
Well, it's what we've been saying would happen all year, that if we don't vaccinate the entire world, that variants will arise and are capable of being brought into this country and other richer countries, because we've dropped the ball on getting vaccines distributed to every other country in the world. So the more the virus circulates, the more it replicates. South Africa is a country where there's a lot of undiagnosed HIV infection, and people with HIV infection are often immunosuppressed, and variants particularly arise in people who are immunosuppressed, get infected with SARS-CoV-2, the COVID virus, can't clear it. That gives them weeks to months of uncleared virus replication, and that's when variants arise. So we're seeing an inevitable consequence of the Western world's failure to help the rest of the world be vaccinated.
So, Dr. Moore, I've been on social media. I've been reading all the headlines about the new variant, and I saw this interesting social media post from a guy who is really outraged, and he's, he blasted the media for what he says is the way we're maligning, we being the media, South Africa. And he says that this new variant didn't originate in South Africa, that it was first cited in New Zealand, England, Brazil, France, and other places. And now the media is making it appear as if, this is the origins are South Africa, and we see these travel bans as it relates to South Africa. So is this, poster on social media right? Or are these headlines right about where this variant originated?
Well, he's right and he's wrong. I mean, it certainly can't blame a country because a variant arose in it. The Alpha variant that dominated last winter arose in southern England. We didn't sink England into the Atlantic Ocean by nuking it, and we're not going to do the same to South Africa. But Omicron arose in South Africa. The South African scientists found it and reported it, and great credit to them for doing so. We're grateful for their surveillance. So, this social media is full of inaccurate information like that. So Omicron's on the radar screens. We need to know a great deal more about it. The most critical unknown is how transmissible it is compared to Delta in a population like the USA. What we've seen consistently is the most transmissible variant wins out. So last winter, we saw Alpha squelch out the 2020 viruses. They disappeared. Then in the summer, we saw Delta squelch out Alpha. Now what's going to happen? Are we going to see Omicron squelch out Delta, or are we going to see Delta continue to dominate the American pandemic and the European pandemic? And in some ways, it's perverse, but we have to root for Delta because we know the vaccines can cope with Delta. So better the devil you know than the devil you don't, because there is a concern that Omicron, to an unknown extent, could compromise vaccine efficacy. It won't be complete. It won't be no effect. It's somewhere in between. We don't know the extent of the problem. But unless it competes successfully with Delta, it will just fizzle out like the beta variant did. We don't talk about that. It just disappeared.
I want to go back to Omicron in terms of its origins. Does it matter the place of origins? You said that Africa has great scientists, researchers. They were able to identify it and provide the rest of the world with good information. So does it matter like where these variants originate? Is that important for us to know?
It doesn't matter. I mean, it's a piece of information, but it doesn't matter in the sense of no country is to blame. I mean, the Gamma variant arose in Brazil. So, so what? I mean, it's a global pandemic. They're always going to arise somewhere. We don't blame countries because a variant arises in their countries. But we're grateful when the South African scientists detected it and informed us of what's going on.
But what about these travel bans? We do act on the origins of, Dr. Moore, by placing travel bans. So if South Africa now, the U.S. is saying, hey, we've got to halt or cease, travelers from coming in and out of that particular country. Is that going to help at all, or is that just kind of useless, given that variants don't care about geographical boundaries?
It's always a day late and a dollar short, and shutting the stable door after the horse has bolted, to use cliches. But the more introductions of a troubling variant that you have, the more likely it gets into a super spreader event and takes off. So it's prudent to try to restrict the entry of a variant that has troubling properties. I mean, no one is pretending that Omicron is a trivial and inconsequential event. We don't know how serious it is, and it may not turn out to be a dominant variant. Let's hope it doesn't. But it's prudent to consider the worst case scenario, and the more introductions we can prevent, the better. I mean, the travel restriction at the moment is illogical. It should have been put in. If you're going to put it in place, why not put it in place on Saturday morning and not Monday afternoon? Why not exclude citizens who are just as capable of bringing a virus back as a non-citizen? I mean, it's all half-assed, in my opinion, of what goes on. If you're going to do it, you do it right. And if you're not going to do it, then let's not talk about it.
Right. So it's being reported, Dr. Moore, that scientists at Moderna and Pfizer will know in 10 days to 2 weeks if their vaccines, which, most of us have gotten one of those two, if their vaccines will be effective against Omicron. So the question is, what's going to happen in those 10 days, and why does it take 10 days for these top scientists to figure that out?
Well, you have to do assays in laboratories, and the assays involve culturing viruses and cells. First, you've got to make the new viruses that reflect the variant. You can't ship a virus in. You have to take the sequences and make a new virus reagent, and then you have to culture the virus in the presence of vaccine sera from vaccine recipients, and then you measure the extent of replication, you analyze the data, and if you're sensible, you repeat the experiment to make sure you didn't screw it up. All of this takes a couple of weeks, and that gives you information on the extent of antibody resistance. It's a number measured in the laboratory, but we have some experience of what those numbers mean, and we know that Delta, for example, is about 4-fold resistant, and we know that Delta, the vaccines are still strongly working against it. If Omicron comes in at some off-the-charts number, we would be nervous about it. So let's see what the numbers are. But it does take time. And getting a handle on transmissibility and the trajectory of the pandemic. I mean, we only heard about Omicron on Thursday. It's been Thanksgiving, it's been a holiday weekend, and the world scientists are working flat out to try to get more information. But people should not be panicking about this. I mean, it's too early to change anyone's behavior.
Okay, that's a good point. So, and that's what the president on Monday came out at his press conference and said that there's reason to pause, he said, but not panic. And you're agreeing with the president that we should not panic.
I mean, I've not lost a moment's sleep about this. It's just another event. You know, let's see what the future brings. If you lie in bed all day, you know, worrying and freaked out, I mean, you're playing in the virus's own game. It's affecting you rather than you dominating your environment. You just get on with your life, see what happens. I mean, irrespective of Omicron, there is a winter-driven surge in infections going on. You mentioned that in your introductory preamble. And that's because the same thing has happened this time last year. Last year, we saw a huge winter surge that was pre-vaccine. It kicked off when the weather turned cold or colder. It was exacerbated by Thanksgiving travel, and then by Christmas and New Year, Chinese New Year, all the holiday celebrations, and we were up to 3,000 deaths a day. Well, this year, about 70% of the country is vaccinated. But the 30% who are not vaccinated, who have been refusing vaccination, they're going to get a rude awakening in December, January, and February. It's like we've got a country of 70 million people. Delta is circulating, and those 70 million people are not vaccinated. That's not a good scenario. We're going to see a lot more deaths in the coming months, and 90% of them, over 90%, are going to be in unvaccinated people. And that's before we talk about Omicron. And this is a national tragedy. It's a self-imposed national tragedy that we have so many people who've been refusing vaccine.
Well, you said, Dr. Moore, that Omicron shouldn't cause us to change our behavior, but I would ask, is it a reason for people who have been resisting vaccines to change their vaccine behavior and actually get the vaccine?
Well, it should be, but persuasion and bringing threats to their attention, I mean, Delta's bad enough. And if they're going to refuse vaccination because they're not scared of Delta, or they've read on QAnon that it's not a real virus, or that the vaccines kill 100,000 people a day and all this sort of crap that goes around, they're not suddenly going to change their minds because of Omicron. The only way to get vaccines up, get more vaccines into more arms, is, to be honest, is forcing it via mandates. It's the only thing that's worked so far.
And what about boosters? So if people have, I think I read a number that said only 19% of the country have received their booster shots. Would you expect by now that that percentage will be a lot higher?
Well, there's been some confusion over the past month or so about who exactly is eligible for boosters. And still, you should be 6 months after your second dose before you get a booster. You can get a booster too soon. You really should be waiting about 6 months. So people who are eligible, and now pretty much every adult is eligible, providing they had their second dose 6 months ago, there's no reason not to go out and do it. It gives you extra protection. If Omicron does take off, you may well need that extra protection, but it gives you extra protection against Delta. So there's no reason not to do this, and if folks should just go out and do it.
And Dr. Moore, you know, so much, we've had so many conversations about this notion of rush science, right? And you still see people today saying they're not getting the vaccine because it's been rushed, you know, even though some people have gotten their first shot now almost 12 months ago and they didn't grow extra arms or legs or heads or anything, you know, crazy like that. If these vaccines don't prove effective in this 2-week period, do you expect there to be a new formulation of vaccines, and how long will that take?
Well, it's possible. I mean, variant vaccines based on the beta strain, which never took off, they were designed and tested in the spring and summer on a just-in-case basis, but they were never rolled out because they were not needed. So the technology exists to tweak the formula, and the vaccine companies are already working on Omicron-specific booster shots. They may or may not be needed. Let's hope they're not needed. If they are needed, it would take a couple of months to get enough of them into preliminary safety testing, FDA to do a rapid approval, get them made in large quantities, get them rolled out. Can't just snap your fingers and there it is. It's going to take a few months. I hope it won't be needed. But it's prudent to plan as if they were needed, and the companies are getting on with it. That's a good thing.
And what about children, Dr. Moore? We know that now vaccines have been approved for kids 5 and older. If you are in a family where people still haven't gotten their kids vaccinated, are they as big a concern in terms of being around them as being around unvaccinated adults?
Sure, they are. I mean, children can get infected and can transmit virus to people around them. I have a good friend, a 50-year-old nurse, lives in New Jersey. Last month, her kids brought virus home from school, or certainly from school, and she had a bad week. Well, she was vaccinated. She wasn't going to end up in hospital. She was in good health. But she had a pretty crappy week and was clearly not able to work. And that's an avoidable event. If our children had been vaccinated and they were not old enough at that time to be eligible, then they would not have brought the virus home from school. They would not have infected her. Well, suppose they've got a grandmother who is in her 80s and for some reason hadn't been vaccinated or even had been vaccinated. Then you're placing your relatives at risk, and in the worst scenario, you can lead to their death. So, sure, kids are not the biggest problem that we face in society. The infection of them is not the biggest issue, but it's still a contribution to helping make the pandemic going away. And I think there are over 500 children in America who've died of COVID. Well, it's not common, but those 500 deaths are 500 deaths that would have been avoided by vaccination. They're 500 sets of grieving parents who wouldn't have had to go through a horrible tragedy. And no kids are dying of vaccination, whatever you read on social media.
Yeah. And just clarify before I let you go, Dr. Moore, the safety rules. I think they get really, garbled as well. If you're vaccinated and you're going, if you're vaccinated, should you go to events, whether they're dinner parties or, we're getting ready for more holiday gatherings with non-vaccinated people, if those vaccinated people will wear a mask? Is that enough protection for you?
I'm reluctant to socially mingle with people who are not vaccinated. I'm not in the slightest bit hesitant socially mingling with vaccinated people. I went to a Thanksgiving dinner at the parents of my son's girlfriend, complicated. It was a family gathering, but they were all vaccinated. I went on the train to do it. I had no issues at all about that. And of course, on the train, you might be mingling with unvaccinated people. There's not much you can do about that. A group of unvaccinated people, I would rather not go there. I would rather not go there for safety reasons, but I'd also rather not go there because I don't want to mingle with people who are irrationally refusing to be vaccinated. They're not the kind of people I want to socialize with.
Yeah.
Sounds cool, but that's the way I see it.
Okay. If people are making that decision to go to events with unvaccinated people, is there some protection that's provided if those unvaccinated people are wearing a mask? Is there any protection?
There's some, but if you're refusing to be vaccinated, that often tracks with refusing to wear a mask. I mean, the two go hand in hand. They're both driven by irrationalities and increasingly politics. So, can you enforce people wearing masks at a social function? It's been very difficult.
Right. Okay, so those social distancing policies still in place, or should we still be socially distancing?
Yeah, I mean, there's no reason to have changed behavior. It's a lot of this is just common sense. I mean, it's certainly in New York City where I live, you have to show vaccine passes to go to a restaurant. I think that's entirely right. You have to wear a mask on the subway, on the bus, on the train. I think that's entirely right. It's very annoying. The people that you see not wearing masks are the freaking police. On the subway in New York City, you never see a policeman wearing a mask, and that's just bizarre to me. They think they're above the law, but everyone else has to.
Yeah. Well, thank you so much, Dr. Moore, for putting us at ease about this Omicron variant. As you said, no need to panic. All the more reason to get vaccinated, although we recognize that some people have just become entrenched in their positions about vaccines. The science is clearly there to support the efficacy and safety of them. So we, again, at the special report, continue to encourage people to get vaccinated. But we'll watch this variant to see. Like you said, just came out, several days ago. So
let's watch and wait. Let's watch and wait. And when there's a need to do something different, then it will become clear what needs to be done differently. Until now, be safe, be prudent, be sensible, and don't do anything differently until there's a reason to do something different.
Great advice, Dr. Moore. Always good to see you, and thank you for helping us make sense of what's happening with COVID-19.
You're welcome.
All right. I want to bring on now internal medicine doctor. He's an award-winning author, and he's the chief wellness officer at the Cleveland Clinic. He's another one of the doctors we've been turning to help us make sense of COVID-19. His name is Dr. Michael Roizen. Good morning, Dr. Roizen, and thank you for joining us again.
Privileged to be here, Reba. Thank you.
So, I stated some of those hospital statistics at the beginning of the show, Dr. Roizen. I know you're at Cleveland Clinic, one of the premier hospitals in this country. What are hospitals experiencing right now? Looks like, the admission rates are going up again.
Yeah, they are. And Northeast Ohio is in the, if you will, north, as you cited, 35 of the states where it's increasing are northern states. We didn't have as big a rush with Delta as the southern states did, and now it's expected, it's moving through the under-vaccinated or the unvaccinated population here. And so we're seeing a increase, but not what you would call a panic increase. It's a doable increase. We're seeing about 1/3 the levels we did in the peak in January, February, which is what you'd expect based on the data and the fact that roughly 60 to 70% of Americans are vaccinated.
I'm curious about why we're seeing these peaks in states like Michigan, Maine, New Hampshire, and not in southern states, Georgia, Florida, Texas, where we know governors in those states have opposed mask mandates. They've opposed, mandatory vaccines. Why aren't we seeing the same rates of increase in those states where they've had these, really kind of oppressive policies around safety with masks and vaccines?
Well, they went through those states already. So they had it before, if you will, we did. Remember, the South had a big increase. And the second reason is there's still warmer weather down there, so they're still not gathering inside as much. Those are the two acceptable answers, but there are a lot of things we don't know about this virus. And whether Omicron is a superhero or a supervillain is one of those. I mean, it's one of the two, we think. But there's so much we don't know about this set of viruses.
So the cold weather. So folks who are living in these cold weather states, what should they know about being inside, whether it's at a holiday gathering? Now we're going to embark upon lots of holiday parties between, now and December 25th. Should folks be gathering at parties? Should people be having, gatherings where they're bringing, 10, 15, 20 plus people together?
Well, if you're double vaccinated and boosted, as Dr. Moore said, and everybody else at the party is vaccinated, then there's really minimal risk of gathering inside even without a mask. But if you don't know the people, remember, we had a problem with PPE, personal protective equipment, early on, and there weren't enough what we would call N95 masks.
Right.
N95, see, if you wear a surgical mask, even two of them, they protect other people. That's a beneficent event. That's a healthy event for society. But if you wear a N95, you protect yourself as well as the others.
But let me stop. So you're saying those of us that wear surgical masks, if we're unvaccinated, we're not protecting ourselves.
Correct. The reason you wear this is to protect others. It doesn't help you much. But two of these is more. It's starting to help you. And really the key is, in fact, I'm wearing that N95 mask. That N95 will protect you and others. So when I go on a plane, and I've been on a few planes recently, and they're all crowded, So that's one of the times I pull out an N95. And I don't think it's extra caution because you're in close proximity with people you don't know. On the other hand, if you're in, a family gathering, everyone in our family was vaccinated, no big deal, right? So it was vaccinated and boosted. The chance of someone there having it and spreading it is very small, especially the chance of someone spreading it and us getting seriously ill.
So we know vaccines, obviously, hands down, most important thing anyone can do at this moment. I know also you've written a book called What to Eat When, and that book is about how do we just improve our overall health. And I don't want to give people the impression that, there's something you can substitute for vaccines, because we've seen that online where a lot of people say, oh, I don't need a vaccine. I'm going to boost my own immunity system by eating X or eating Y. But, as a doctor that spends a lot of time helping people understand how to just overall be healthy, are there other things we should be doing right now to protect ourselves against the virus, in addition to not, not getting the vaccine, but is there anything else in addition to the vaccine we should be doing?
Well, the most important thing for your immune system is sleep, and then getting and it's actually the most important thing you can do before you get vaccinated, is to sleep for 6.5 to 8 hours for at least 3 days beforehand. That boosts your immune system when you get more sleep. And then taking a multivitamin for, again, about 3 weeks beforehand. So those are all good things. And even if you do it a couple of days, they help. Now, there's some specifics that help from, if you will, long-standing. One is getting the right amount of omega-3s. Omega-3s are the healthy fats. They're often called fish fats, or if you will, the oils from fish. The only ones in America that predictably have it are salmon and ocean trout, because all the other fish are fed soy and corn, which means they don't have fish oils anymore in them. So you want to get fish oils and vitamin D. Those two things help resolve. A lot of our symptoms are the immune system attacking and it not getting resolved. So you see that with, if you will, the production of phlegm and other things, and even the production of badness in lungs from this. And so omega-3s and vitamin D are helpful in that. We don't have good data saying they're really helpful versus a little helpful, so we don't have, but they're important in the resolution of it. But again, sleep and a multivitamin. Now, what about chicken soup and zinc lozenges?
Let me ask you about that salmon, because we know that salmon has cholesterol, right? And what about people who have heart condition or high cholesterol? Should they be worried about, trying to get this omega-3 through salmon, because they may be, impacting their cholesterol in a negative way?
Well, it's very little effect on cholesterol. The cholesterol in food doesn't really affect, believe it or not, sugar is much worse for cholesterol in your blood, and even honey and syrups and simple carbs are much worse than is the cholesterol in food. But in any case, the other things, chicken soup may be something that is really valuable. We don't know, but it increases nasal mucosa flow. And remember, it's the nasal mucosa that is one of the two areas that this particular virus attaches to. Some specific cells in your nose and in your lung are where this attaches. And it is the ones in the nose that seem to be able to spread the infection. So especially important, maybe chicken soup, which increases that. So we don't know that, but it does shorten common cold.
Chicken soup is helpful or not helpful? I'm
yes,
confused.
Healthy. It is healthy.
Okay.
Because it increases this secretions which prevent the infection from taking hold.
What about the
And
people
so
that don't eat chicken, Dr. Roizen? What can we do as a substitute for chicken soup?
we don't have a good alternative, unfortunately. Your mother told you chicken soup, and she was right on that.
Okay. So
But
vegetable broth won't do
and
it.
let me go and say one more thing: is make sure you get a flu vaccine, because you don't need one of the worst things you can have for your immune system, as Dr. Moore pointed out with another disease, HIV, is to have your immune system already engaged in another battle. You want it to be able to focus on this one alone. So you want to get your flu shot. And then the other thing is, if someone in the family, my son's kids, my grandkids went to school, and they bring home every bug right away because they haven't been exposed to kids for a while, and when they come back, they're bringing home so that's when you might say, if the kid is bringing home something, or you have a child at a school, you're going to see your grandchildren, that's maybe where you should have the zinc lozenge, which prevents those colds or shortens the time frame of them.
So, okay, I got to get back to the chicken soup for us non-chicken eaters. So vegetable broth won't do it, right? There's something unique about
We don't know that it doesn't do it. It just hasn't been studied, believe it or not. So I can't say that it won't do it. It may do it, but we just don't have enough data.
And talk to us some, Dr. Roizen, about these breakthrough infections, because we keep hearing about people who are getting breakthrough infections. And that's one of the arguments that some anti-vaxxers will use. They'll say, well, John Smith was vaccinated and still got COVID. So the vaccines, therefore, they get to some kind of conclusion that the vaccines don't work. Why are we seeing these breakthrough infections?
Well, the vaccines are only about 90% effective because of our immune system. So the way a vaccine works is it gives you something that your immune system develops a punch against, that identifies, your immune system will identify and try and knock out or literally swallow. But in our immune system, as we get older, or even in random fashion, only gets about 90% effectiveness even from this. So 10% of people won't get an immune response to the vaccine. That's still 90% are getting it. That's a huge benefit. So, and as time goes on, that 6-month period for Pfizer, 8 months for Moderna, your immunity wanes and you need a boost up. So a lot of the breakthrough infections are from people who didn't have the full course of vaccines, didn't get that initial benefit, and who haven't gotten boosted. And as we go longer, and maybe with this variant, we'll have a problem in that our immunity from these vaccines won't work. That's why this virus in this current mutation, Omicron, could either be a superhero or a supervillain. Superhero, it's very transmissible, so all of us will get it, but it doesn't have any more effect than a common cold. If it's that, it's a superhero, because then all of us get herd immunity and we don't get very sick. On the other hand, it could be a supervillain where it is, if you will, we get infected, it's very infectious, and it causes serious illness. That's really the 2-week waiting period. We got to find out what's happening in real practice and what happens with the vaccine's effectiveness.
Yeah, people get frustrated, Dr. Roizen, because when you say what you just said is that we don't know, it could be a superhero or a supervillain, they point to that, again, some anti-vaxxers, and say, that's why I'm not taking the vaccine, because the doctors don't know what they're talking about. They say that they've got to wait, they've got to see, they equivocate. Help us understand why, what you just said.
You don't have to wait at all for preventing Delta. And as I've been on the show before talking about long COVID, you don't have to wait to protect yourself against long COVID. The Delta variant is a gosh awful variant. It causes long COVID. It's going to cause not only heart attacks and strokes from the inflammation it causes in people who have plaque already, But in the long variant, when you look at where it is in the brain, as we tag it, it's right where Parkinson's disease is. It's going to cause, we fear, this long COVID will cause a rash of Parkinson's disease, just like the Spanish flu of 1917 to 19 did 20 to 40 years later. So if all you care about, and all you have to do is go and watch a Parkinson's disease patient, you feel so horrible for them, you can prevent it in yourself. Remember, the long COVID is 30%. So if nothing else, you should get vaccinated against the Delta variant, because it's almost a totally preventable disease. And especially if America got vaccinated almost completely, we'd have herd immunity and we wouldn't have to worry about it as much. So it's really important.
You said something really, really profound and significant, and I'm not sure I've heard any other experts say it. You said long COVID impacts the brain in the same way that Parkinson's does, or where Parkinson's originates in the brain?
When you tag the virus, it's attacking the same cells in the same areas that die with Parkinson's disease. And the real problem from the Spanish flu going out of that is most of the cases of Parkinson's disease in the subsequent era, 20 to 40 years, were due to the virus of the Spanish flu attacking those basal ganglia, what we call the dopaminergic ganglia. Those are the same ganglia that are being attacked now by this long COVID virus. And so if you're going to say, if we're scared as heck about that, there's no definite proof. We're just scared as heck because it is in the same basal ganglia area. And that's something you can totally prevent now with two shots and a booster for those who've already had the shot 6 months and 8 months ago. And there's no reason to not protect yourself from that. It's a unforced error.
Yeah. You know, it's so funny, Dr. Roizen, I was reading an article about transplant patients. Many transplant organizations now are requiring both the recipient and the donor to be fully vaccinated. And they interviewed in this, I think it was a New York Times article, recipients who have been on these waiting lists for kidneys for years, and you know how difficult it is, who are saying they refuse to get vaccinated and they're willing to forego getting a kidney, knowing that, you know, it could kill them, or they could be on dialysis for, you know, indefinite periods of time. So that anti-vaxxer message has, you know, and one woman, they were asking her, like, why? And she still was saying things like, I don't know about putting this foreign substance in my body, although she's going to take a kidney from another person's body. So I didn't get that logic. But she was saying, like, you know, it hasn't been enough time. It was developed too quickly. All of these arguments that have been debunked by the evidence of, you know, how effective.
You know, there is no vaccine that has been deployed this widely ever. Forgetting measles or polio, none of those vaccines got deployed this widely in a shorter period of time. And they're just, yes, there is a risk to the vaccine, but the benefit, as I said before, it's like putting $1 down on a bet and you getting 10,000 back, or you lose the dollar. That's the lowest benefit, and maybe 40,000 to 1 for those people over 60 or who have comorbidities like obesity or diabetes or need a kidney transplant. It's at least a 40,000 to 1 benefit for kidney dialysis patients. So to not do this is just, you've got to say, where has the information that has led you to not do it? This is, look, the FDA allowed parallel tracks to go on. Instead of doing things sequentially like they normally do with vaccines, which take an 8-year period, and the Trump administration should get credit for this. They fast-tracked it, so they did everything at once. So instead, they put the gamble on the companies, but they took the risk off of that by paying the companies to do it. So in fact, the prior administration, whatever you say about them, they actually fast-tracked this in the right way so that the vaccines are incredibly beneficial. Mm-hmm. Not perfectly safe, but at least a 10,000 to 1 benefit to risk ratio. Put that dollar down and you get 10,000. I don't know anyone, when I talk to patients, and I have a few that don't get vaccinated, I don't know anyone who doesn't understand. You put a dollar down, you get 10,000 back, or you lose a dollar, doesn't understand that's a good bet. That's the bet that getting the vaccine is.
I don't want anyone that's, going to cling to every word that you say and try to, make it into something negative. You said the vaccines aren't perfectly safe, and you said there is risk. What do you mean by that? Like what?
Well, I mean, there is nothing that doesn't have a small side effect in one way or another. Mm-hmm. But the benefit is so much greater than the side effect. That is, the chance of your getting benefit is at least 10,000 to 1, the chance of you getting risk if you're in the population of 20 and older. In the younger population, it may only be 3 or 5 to 1 for you. It's society that is even getting a greater benefit, but it's a better benefit than risk at all ages. Mm-hmm. And if you consider long hauler, and this is not taking into account long hauler, it's probably a 10,000 to 1 over everybody, because that virus, even in the kids, is causing long hauler syndrome.
And just to make sure everybody's clear, is there any medicine that's prescribed on the market today that doesn't have some risk associated with it?
I don't know of any that doesn't. In fact, in the FDA, the FDA has a system of phase 1, phase 2, phase 3. In every drug, in phase 1, you've got to find a side effect, or you can't even go through the FDA approval process, because they know every drug has some side effect. So we go through phase 1 is where is the top dose you can have without a side effect.
So, and that kidney recipient who's already on dialysis is already facing some risk from dialysis. Obviously, there's risk associated with putting a kidney in your body from another person's body. So there are risks all up and down that person's medical journey already.
Oh, they have huge risk. They constantly have a sizable risk, and they undergo. Dialysis is 2 to 3 hours at least 3 times a week, usually 2 or 3 times a week. That's a lot of time, and getting a kidney transplant is a huge benefit. And to say I'm not going to stay in the line to get a kidney transplant because I don't want to get the vaccine is, I think, not understanding how beneficial the vaccine is, even if they don't get the transplant. That vaccine is a huge benefit because a dialysis patient already has an increased risk of having a serious side effect from the virus.
Well, I don't think you can make it any plainer. Dr. Roizen, I won't ask you to explain it yet, a 1,500 times. You've made it pretty clear that there are enormous benefits associated with vaccines, even setting aside this new Omicron variant. We don't know what's going to happen with it, but we already have enough evidence before us with the Delta variant that should propel every person over the age of 5 years old to be fully vaccinated.
No, that's absolutely true. Just take a look. 25 to 35% of people who get the disease, even a mild case of it, develop a long hauler syndrome. I mean, we think there are 6 million people now in the United States unable to work. That's part of the labor participation decrease. They're unable to work because they've got long hauler syndrome or are caring for someone with long hauler syndrome. So it's a huge problem for the country for people not getting vaccinated and developing a long hauler syndrome. And you don't want it. Yeah. And you don't have to have it. get I can't say it any clearer, get the vaccination and get boosted.
Well, great advice. And I want you to know we're going to post the list that you gave about things we can do in addition to the vaccine to improve our overall health. Your book, What to Eat When. We're going to, give people a link where they can purchase that book and they can find out more about how to, again, just, improve their overall health, because that's what the name of the game is.
Areva, if I can give one other plug.
Oh, go ahead.
I'm running a conference this weekend at CCF, Cleveland Clinic Foundation, CME.org. If any of your physicians or any caretakers or any practitioners of any kind it's on longevity. And believe it or not, there's some great news that if we survive this, you're going to get a 30-year boost in your longevity, most likely within the next decade. So we've increased the number of years people live since 1900, since 1890, by about 2.5 every 10 years. So life expectancy has gone from about 37 to about 77, 78. It's going to take a 30-year jump in the next decade. And we're getting some of those brilliant discoveries now. So we'll be reviewing them, ccfcme.org/wellness, if you want this weekend.
Wait a minute, Dr. Roizen. What age person today is going to benefit from this 30-year longevity boost?
Well, if you make it 10 years, you're going to get a benefit. So it is literally going to change the death rates dramatically. So it's not going to cause new fertility. It's not going to increase or decrease immigration. Those are political decisions, but it will radically change the quality and length of your life. So when we, and your producer knows that when I did this on Oprah in 1999, we said 60 would be the new 40 by 2020. We're now saying by 2035, 90 is going to be the new 40.
Oh my God.
It's not that you're going to be old and not knowing whether you had peas or pistachios. It's going to be, you're going to be 90 and a kick-ass producer.
Hold on. I just got to do the math on this. So a person that's 50 today, they live to get 10 years to become 60. Their life expectancy is going to be plus 30. So their life expectancy will be 90.
Their life expectancy will probably be about 110.
Woo!
With about an 80%, it's not 100% surety, but it's at least an 80%. It's now with 14 different things in at least 2 different animal species.
Wow. I got to have you back. I'm out of time, but I got to have you back after this big conference where you're going to talk about longevity. We're going to have you back to do a whole show on that, because I'm sitting here thinking about all the stuff I want to do at 90 now. So.
Well, no, that's it. But you're going to be functionally 40. So you'll still be able to do the special report.
Wow, that's amazing. Okay, I'm all in. Can't wait for this conference. We're going to post, you said
ccfcme.org/wellness.
/wellness is the conference for practitioners and medical providers. And then I'm going to have you come back and train.
And anyone who's a caregiver. I mean, it's going to be in general enough terms that everyone will be. What it is it's a really serious look at the 14 areas that are advancing in a very quick way to change the rate of aging all of us undergo.
Okay. And I know you've written a whole new book about longevity, The Great Age Reboot. It's available now for pre-order on Amazon, or it's coming. Is it out yet, or it's coming?
No, it's not out yet. Believe it or not, we got slowed by the pandemic because they can't get the paper that needs to be printed on into the West Coast ports.
Yeah.
So
I know that drama. I have a book out now that Amazon doesn't have in stock, not because I've sold 100 million copies, but because they can't get enough paper to print the book. So I understand that struggle 100%. But we'll have you back. We'll talk about your new book, The Great Age Reboot. We'll talk about longevity. We'll talk about all things living longer and being healthy. Thank you so much, Dr. Roizen. I learned so much.
And tell people to start by getting the darn vaccine now so they don't get Parkinson's disease.
Wow. Yeah, if you want to be here for your 30-year boost, you better get that vaccine today. I love that. Thank you so much. What a pleasure to see you. Lots of great information today. Always a pleasure to sit down with you. All right. I want to thank my guests today. I want to thank these great doctors. Man, that's going to be exciting news that we are going to live, many of us, 30 extra years. So you got to get to planning. But again, you got to have that vaccine if you want to be around to add those 30 years to your life. What a pleasure to sit down with Dr. Roizen and Dr. Moore. We're going to follow what happens with this variant, keep you updated because we want you to have the best. We want you to have the most accurate, the most up-to-date information on COVID because we don't want you to panic. We do want you to pause, though, and be aware of what's happening around you. Of course, we want you and everyone in your family, all of your loved ones to get vaccinated. We're going to just keep saying it over and over and over again. Get the vaccination, get that booster shot. It can literally not only save your life, we're now hearing from Dr. Roizen, it can expand and increase your life and your longevity. Just some words to live by. We are not out of danger. Yes, people, I know you're over it. I know everybody wants to be over it, but we are not. There's so many things that we have to continue to be mindful of. We have to keep ourselves and our families healthy. We have to do those things that make sense, those common sense things. Wear our mask when we're in crowds. Get that vaccination. Practice social distancing when it needs to be practiced. And then I'm going to, on Facebook show you where you can get Dr. Roizen's book. And he said, sleep. He said, omega fats. He says, omega-3. He said, vitamin D and practicing, health and wellness. So we can all be around for those extra 30 years. I'm super excited about that. I'm out, y'all. Don't forget to wear your mask. And don't forget, we're all in this together.